More interviews on Spectrum, Radio 1 FM 90.
A very warm welcome. This is Spectrum on Radio 1. I'm your host, Edmond Kizito. On Spectrum tonight, the fight against HIV and AIDS. Why is Uganda facing stagnation? What are the other critical issues that need to be addressed in order to rekindle this struggle? It is exactly 30 years today since the first case of HIV and AIDS was recorded, and Uganda has joined the rest of the world today to mark this day, now known as the World AIDS Day. The latest figures from UN AIDS indicate that today there are 34 million people living with HIV and AIDS, and Uganda has 1.2 million of those, representing around 3.5% of the total global burden. 10 years ago, Uganda had become a leading voice in the fight against HIV and AIDS, and its political leadership had become an icon in this struggle. Today, concerns are being echoed around about the rising rates of infection and the growing number of persons that need urgent treatment, yet the country cannot easily find the funds needed. The trends of infection are also disturbing, with reports indicating that infections are high among married couples, newborn babies, and also university students. Stakeholders have argued that the decline in political leadership as far as fighting AIDS is concerned is one of the reasons for the decline. But why has the political class abandoned this struggle, yet it was a key priority 10 years ago? Other people say that another challenge is a poor healthcare system, with numerous reports of shortages of health workers, lack of drugs, and neglect of other critical aspects that could help in addressing HIV and AIDS, plus other diseases that are related to it. The theme for this year's World AIDS Day is getting to zero. Zero new HIV infections, zero discrimination, and zero AIDS-related deaths. So tonight, as we commemorate the World AIDS Day, we ask, what will it take Uganda for it to rekindle its fight against HIV and AIDS, and what are those critical issues that need to be addressed as a matter of priority, looking at the infection rates, those who need treatment, and the state of our healthcare system. Our guests tonight, Dr. Raymond Byaruhanga, Executive Director of the AIDS Information Center. You're most welcome, Dr. Byaruhanga.
Good evening, listeners, and thank you very much for hosting me here.
We are also joined by Honorable Bettie, Kamya, President of the Uganda Federal Alliance. You're most welcome, Honorable Bettie, Kamya.
Thank you, Edmond, and good evening, listeners.
Dr. Byaruhanga, you come from the AIDS Information Center. As we mark 30 years against in this struggle against AIDS, let's look at some of the figures. Some time back, Uganda was a big name in the fight against AIDS. What are the figures like right now, and what are the trends?
Yeah, thank you very much, Edmond. Currently, as you've already mentioned, we are looking at an HIV number of people living with HIV in Uganda today at about 1.2 million. And I think in the early 80s and 90s, the HIV prevalence simply means how many people at any one time are HIV positive. And it was about 35 to 40%. Over time, as a result of the political leadership, as a result of a lot of technical people putting in their efforts, it has come down to about 6.4%, right way back as 2005. And from 2005, as you say, it has stagnated. But other figures that really we need to look at, apart from the number of people who are living with HIV, is the number of people who are testing today for HIV. People who have tested since actually the early 80s and 90s to today, we only have about 40% of Ugandans have had an HIV test. An HIV test is when you know where you stand. And now if 40% of Ugandans know the HIV status, 60% don't know the HIV status. And I think that is where we're getting a bit of a challenge in terms of people, because this is the gateway into getting into prevention services, care and treatment. If Edmond and Bettie here, if we are to be seated here and we all don't know HIV status, I think that is where we begin to have a bit of the challenge. So 40% of Ugandans, 60% of Ugandans who don't know the HIV status is quite an alarming figure. And we are here talking about trying to fight this epidemic. I don't think we'll win it if we continue at this rate.
So you think we should be starting from providing testing?
We should scale up testing for HIV. We should, and when I'm talking of scaling up testing for HIV, we should be seeing our pregnant women all being tested. We should be seeing children born to any mother being tested for HIV. We should be seeing all our Ugandans irrespective of what age, irrespective of what class, irrespective of what culture, tradition, all knowing the HIV status. It's because through this, you as an individual will take a decision whether you are going to continue living a reckless life, or you are going to live positively, or you are going to make sure that you prevent yourself, your pregnant wife, or your mother, or whatever from getting HIV. So HIV testing is the gateway. We can talk about prevention, we can talk about condom use, but you will not use a condom if you do not know your HIV status. Or if you know, if you are going to use a condom, you might probably use a condom as a fact of saying, let me not pregnant someone's daughter. But specifically, if we are going to intervene and have strategies of prevention in this country, we must begin from a point of knowledge. We must begin from a point of you or your partner knowing his or her HIV status.
Honorable Bettie Kamya, looking at the figures, a steep decline from 35 to 40% of HIV prevalence in Uganda to 6.4% and then stagnating. Looking at it broadly, what do you think could have gone wrong?
First of all, on this World AIDS Day, I would like my heart to go out to all those people that have suffered from AIDS. And in Uganda, most families have felt the wrath of AIDS in one way or another, directly or indirectly. And my heart especially goes out to those children who have grown out without parents. Some children, even both parents, and those children that have grown up in children-led families and families that have been split. So-and-so is with auntie so-and-so, Tom, uncle. I know of a family of 8 whose parents died within 6 months of each other, and the 8 kids were then between 12 to 2, and they were all separated, and I don't know whether they even have ever found each other. And that's a common story. It's a very, very sad story. So on this World AIDS Day, I would like my heart to go out to all those people that have been affected in one way or another. Having said that, these statistics, to be quite honest, they look a bit dubious to me, but I will take them from professionals.
Go on.
Because they're given by professionals.
Yes.
But if you say prevalence of 40%, it means in every family of 6, 2 have tested, or 2 know their status, or 2 are if that's what prevalence means. And this is about how many years ago, Doctor?
This is 20 or 30 years ago.
This is about 30 years ago. If 40% knew their status, or it seems a very dubious figure, because 40% don't even have access to medical health care. They don't. So where did these figures come from? And Doctor, the things you're saying, that's what it should be. But is it possible? How many people have real access to medical facilities that they should be? And when they have access to medical facilities, are those medical facilities equipped to test? Like, I'm looking at a village I visited in Karamoja about this time. By the way, this time last year, I was in Dokolo.
Yes.
That's where Dokolo County district, and that's where I celebrated Uganda AIDS, this World AIDS Day,
right.
Because I was on my campaign trail as presidential candidate, and I went deep in the village of Dokolo, and most people are using herbs. They still even think it's witchcraft. So really, I mean, these are good things, the ideal. But I would like the doctor to tell us about the real situation. It would be good if every kid that gets born gets tested, and every woman who gets pregnant gets tested. But how realistic is it? And we should be talking about the capacity of this country to provide such logistics And if that capacity is not there, then who is responsible and what should we do about? And for me, I'm sorry, my mind always races to the fact that that woman I talked about in Dokoro, whom I saw, she is about 40 years old. Looks 60, but maybe about 40. She has paid taxes from the day she was born, beginning with the razor blade which cut her umbilical cord, and never stopped paying taxes for everything that she has used all her life. The second-hand dress, the ajon, the whatever, all her 40 years, every day she pays a tax. But she cannot access. And does she know where her taxes go? Her tax ends up in Kampala. And then that woman and her grandmother before her grandmother also paid taxes, beginning with the razor blade, which cut her umbilical cord, up to the coffin in which she was buried. But her grandmother also was buried destitute, and her daughter and her granddaughter. But all those taxes for a period spanning 80 years.
They came to the capital.
They come to the capital, but they never go back. So we need to examine a system that takes, but never gives back.
What's the ideal system, very briefly?
The ideal system is a system where you don't send.
What is it called in one word?
It's called federalism.
All right. Dr. Byaruhanga.
I really don't want to politicize this.
No,
I'm raising real issues that people give, but they never get back. Right. So if you give, but never get back, what do? You should hold on to your...
You're saying the structure is wrong. The structure is flawed. So even as we fight AIDS,
whatever
we're going to find a very weak...
You're going to have a problem. And we keep coming back to this problem. You're going to talk about oil, you talk about Demanga, you talk about roads, you talk about schools. Every day we are celebrating World Something Day. World Something Day. World Something Day. And we come here and talk about just the same thing. We just cut and paste. And just
from the previous year,
or the previous function, because tomorrow it will be World Environmental Day, World Women's Day, World Something Day, World Water Day, and you just cut and paste and remove water and put AIDS.
Yes.
And it's the same story. And remove AIDS and put environment.
Not tobacco. World Cancer Day.
It's the same story. Cancer Day, Roads Day. Now there's World Everything Day. Almost every day we're celebrating or commemorating a world something.
Yes.
But the story is basically the same, that down there where it matters, there's no impact, no change. It just doesn't reach them. They're in another world altogether. And those are the things that I think we should stop being stereotyping and just debating days as they come and file that day away. We must go back and say what really is the problem, because there's a fundamental problem that we need to address.
All right, Dr. Byaruhanga, I would like you to talk to us about AIDS. What exactly is AIDS? But before you do that, could you get us back to these figures that you raised, which you opened a little bit? 35 to 40% prevalence rate, then 6.4%. Can you explain them better? Then we'll go to the...
the prevalence, and which is something that I would want to actually get out of, because prevalence is a very deceives a lot. Prevalence simply means at any one time how many people are actually infected, in this case HIV,
right?
How many people have HIV, and currently as we speak today it's an approximate number of 6.4%.
Yes,
but the number that we need to look at is the new infections.
Right.
And why do I say that prevalence kind of deceives? It's because you must have read in the papers of recent that actually we've cut down the death rate to about 30%. So we're having more people actually living longer, which is a very good thing. But what does that mean? That means that actually, if you look at the prevalence, you probably be talking about an increase in HIV prevalence. And that does not, that negates the actual sense of what we are really trying to answer here. But the problem, the biggest problem we are facing, and I want to concur with Betty, is the new infections that are increasing every year. Annually, we have 100,000 plus people getting infected. Last 2007, we had about 124,000 people. 2009, we had about 124,000 people infected, newly infected. The previous year, they were not infected. Last year, we had about 130,000 new infections. And this continues to increase every year. This number, vis-a-vis the number of people we are putting on treatment, every year. It's only this year that we are trying to target to get 100,000 people onto treatment. But every year we put about 50,000 people onto treatment. Now, if every year putting 50,000 people on treatment, in the same year you're getting 130,000 new infections joining the 1.2 million people, we're not going to make any headway. And I think that's where we are having a bit of a challenge. And of the 124,000 new infections that occur every year, 27,000 are babies.
But how do you get those figures, doctor? You just said there's no checking.
Yeah, we use kind of modeling figures, and we use surveillance sentinel sites, whereby at least we know
you monitor.
We monitor on
just like the measure inflation.
Yeah, on a monthly basis we look at how many new infections occur, and we also know that, for example, out of 100 mothers who get pregnant and are HIV positive, we know that 30%. That is 30 mothers out of the 100. If nothing is done to them, they will produce HIV negative babies. But we also know that 30% will also produce, if nothing at all is done, they also produce HIV positive babies. So there are all those modeling factors, and when they come into play, that's why I was telling Honorable Bettie here that whereas we are talking about 1.2 million people that are HIV infected, with 40% of people knowing their HIV status, 1.2 million people is out of 33 million people.
Yes.
And we are looking at a prevalence of 6.4%.
Yes.
So 6.4 out of 33 million is about 1.2 million.
Yes.
But remember that we have only tested 40%.
True.
60% are not tested.
Yes.
And that's why we are saying that about 40% of these are known. 40% of the 1.2 million people, positive people, are known. We don't know where the other people are.
Right.
It's because probably the systems are very poor. We don't have enough. We are not procuring enough test kits. We don't have enough doctors and counselors to be able to counsel these people. We don't have enough drugs in the facilities to be able to give even these the ones that you know, 500,000 people that we know. But the good news already is that at least we are getting about 500,000 people onto treatment. Annual, this by the end of this year, we'll have about 500,000 people onto treatment. But my biggest problem is, what about the 700,000 people out there? They are including the children. We are looking at orphans, as Honorable said, orphans. But how many orphans? We don't know even those orphans from 2 to 13 that she's talking about. How many have had an HIV test? Some could be HIV positive and not accessing treatment. Why? They were not tested. They were not given any information about HIV. Probably they were even denied to be told that their parents had died of HIV, because that would stigmatize them. And then lastly, they cannot even access the ARVs wherever they are. So the challenges are many. The challenges are so enormous. And the problem is the increased number of people that are getting infected. That's why UNAIDS is saying, can we try to target 0 new infections?
Yes.
If we can get to that, in PMTCT, Prevention of Mother-Child Transmission today, we have just launched a program to eliminate mother-to-child transmission in Uganda.
Right.
Will we get there? Bettie will tell us systems are still very poor.
Yeah.
We are trying to build up on the systems. But to what, when, and what will it cost Uganda to be able to get to 0 new infections from 130? And annually, we're increasing by about 5,000, 10,000 new infections that are occurring.
Very briefly, maybe we'll go for a break. Can you tell us exactly what is AIDS?
AIDS is a disease that comes out of a group of diseases that come out of someone who is infected with a virus. When you're infected with the HIV virus, the human immune deficiency virus, you look fine. But when it affects your immune system, you will get a number of diseases. And these diseases are in a syndrome. That's why it's called, it's AIDS. The AIDS syndrome has a syndrome.
Right.
But there are quite a number of diseases that go with it. Right from your brain, to your eyes, to your mouth, to your skin, to your lungs, your liver, your heart. Practically, the moment your immune system goes down, your whole body function
You're susceptible
down. You are susceptible to
everything,
including malaria,
right?
Including tuberculosis. So the moment you get tuberculosis, you get malaria. The old time we would not see before AIDS, before HIV, we would not see measles in adults.
Right.
There are some infections that occurred in young children, and as a result of the immunity, they would grow out of it. Today we are beginning to see people with childhood diseases,
and they are grown up.
And the result is as a result of HIV.
Listeners, this is Spectrum on Radio 1. Tonight, the fight against HIV and AIDS. Why is Uganda stagnating, and what are the other critical issues that need to be addressed in order to rekindle this struggle? We'll go on for a break. Do stay with us. We'll be back.
Let the sun
Good morning, sunshine of my life. You look happy today.
I am. I came here and I saw there was a whole pile of washing to do.
But I thought you didn't like doing the washing.
No, I have it. Anything else you need washed?
Sunlight 2-in-1 with added fabric softener. Smells so good, you want to use it again and again.
Let the sunlight in.
Sunlight 2-in-1. Sunlight clean, sunlight fresh.
Sunlight in. Happiness is all around. Let the sunlight in.
John, Mike and I will go back a bit. We knew John at the beginning, working for someone else. But he was different. He had vision, saw opportunities. He started working towards his goal, opened his own garage, and worked, learning the hard way. His reputation spread. Trust, consistency, quality. Soon people were coming to him from all parts. He made himself and his whole street prosper, and also help friends, seeing potential in people and helping them on. But John never shouts about all his success. He's just who he is. Special.
So here's to one like John, who make a difference, who enjoy Nile Special, the rich, satisfying taste from the sauce. Nile Special.
You've earned it. Not for sale to persons under 18.
Is your internet provider turning your world upside down? Broadband Company offers fast and reliable internet solutions. And for the first 100 subscribers this month, we offer zero connection fees. Save up to 400,000. For more information on these offers, call toll-free 0800 222 111.
Broadband Company. More than you expect. Spectrum on Radio 1 FM 90 is brought to you by Stanbic Bank.
Welcome back. Tonight on Spectrum, this World AIDS Day. The fight against HIV and AIDS. Why is Uganda stagnating, and what are the other critical issues that need addressing in order to rekindle the struggle? Our guests tonight, Dr. Raymond Byaruhanga, Executive Director of the AIDS Information Center, and Honorable Bettie, Kamya, President of the Uganda Federal Alliance. Honorable Kamya, there was a time when President Museveni spoke about it a great deal. It was in campaigns. We had campaigns targeting the youth. SIFA was as an acronym, Safeguard the Youth Against AIDS, and it was all over the place. The infection rates came down. He seems to have kept quiet, and now, probably the figures have stagnated. Where do you think we should start from?
Well, first of all, leadership. When you spearhead something, normally, I don't want to lay much blame on the president for that, because when you spearhead something, you spearhead it. Literally, that's what it means. And then other people
Should be able to
come in, and then you move on, and they should be able to carry it forward. It's not as if you are the one who must, because every time there's a new challenge for a leader to spearhead, you are supposed to start off something and then
give it a momentum,
and then move on to something else that needs your attention. And the people that you're working with, or the people that you have delegated, the only thing I see is that I don't think that the system was established. I mean, after when the president started this, then there was Tasso came in, did a very good job. Then there was Weso who took on the young children. Then there were all these AIDS commissions and things. Enough attention was given, as you say, at the time. But then it kind of, and then it worked for a while. That's